If you're turning 65 or helping a parent navigate Medicare, you've probably realized something. It's not easy. And there's so many different moving parts and plans and things to consider when signing up for the first time. You truly need to be educated on all your options because you have thousands of them. We're going to educate you on the basics of Medicare, the things that you need to know before you sign up for the first time, the things to avoid, common questions that you should be asking, and we're going to help you make Medicare easy. So I'm going to share my screen, and we're going to go through this slideshow today. So my name is Cody Brown, and I'm with Senior Benefit Services. I've been helping people navigate Medicare and educating them since 2016. All across the country, mostly here in the Kansas City area. But here's the disclaimer that I'm required to read before we get into things. We're not affiliated with or endorsed by any government agency. This is a solicitation for insurance. By responding to this ad, you may be contacted by a licensed agent to discuss Medicare supplement plans, Medicare Advantage plans, and prescription drug plans. Now, this is truly an educational video. This is not a sales video, so we really just want to make sure that you understand the basics. This is what we're going to cover today. What is Medicare? What does it cover? What does it cost? We're going to go through the ABCs of Medicare, the different pathways of Medicare. We're going to talk about original Medicare versus a Medicare Advantage plan, how to select the right plan based off of your needs and budget. There's no one-size-fits-all plan. We're going to talk about what to look for in premiums and benefits and enrollment and updating your coverage. So what is Medicare? Medicare is government insurance. It was founded in 1965, and it's administered by CMS, which is the government, financed by payroll taxes and monthly premiums. So you paid into Medicare taxes your whole life, which is why you qualify when you turn age 65. So people over the age of 65 qualify for Medicare, or if you're under 65, you can qualify as well if you have certain disabilities. You can also qualify if you have end-stage renal disease. So these are the four parts of Medicare: Part A, Part B, Part C, and Part D. So we're going to dive into each one, and we're going to start with Part A. Part A and B is what makes up original Medicare. Part A is going to cover things like inpatient stays, skilled nursing, home health care, and hospice care. It's really going to cover anything if you're confined in a hospital or skilled nursing. Cost for Part A, most people pay zero premium for Part A. If you've worked at least 10 years or paid into taxes for 40 quarters, then you qualify for premium-free Part A. Now, what's that going to cover? You're going to have a deductible of $1,736 in 2026, and that's going to be per benefit period. So that begins the day that you're admitted into a hospital or skilled nursing facility and ends when you haven't received any inpatient care for 60 consecutive days. Skilled nursing facility costs, the first 20 days are going to be $0. Days 21 through 100 can get very expensive, $217 for each day. If you're staying overnight in the hospital, you pay nothing after your deductible for the first 60 days, but if you're in there for more than 2 months, you can pay those copays of $434 per day or $868 per day, depending on how long you were in there. Now, Part B, the second part to original Medicare. This is going to be your outpatient. So things that cover like doctor's visits, labs, tests, x-rays, outpatient care, preventative services, sometimes home health care, sometimes durable medical equipment. Is all going to fall under Part B of your Medicare. Premium for most people is $202.90 a month. And if you're drawing Social Security, they automatically deduct that out of your Social Security check without even asking you whenever you turn 65 years old. So that premium could be higher based off of your income. In 2026, if you made more than $109,000 individually or $218,000 joint, your premium could be higher. It could be $300, $400, $500, $600 a month, depending on what your income is and where you fall in that age bracket. Now, I get the question a lot of, how do I pay my Medicare premium? If you're not drawing Social Security, they don't have anything to deduct it from. So if you want to apply for Part A and Part B, and you're not drawing Social Security, they won't automatically enroll you into Medicare. So let's say you're turning 65 years old, not drawing Social Security, what do? About 3 months in advance, before your 65th birthday, you'll want to apply for Part A and Part B, and you can do that through the Social Security Administration, ssa.gov. And once you apply, they're going to send you a bill in the mail for a quarterly premium. So it's going to be $202.90 times 3. You can pay that all at once, or you can go to Medicare.gov and you can set up what's called Easy Pay, where they're just going to take it out automatically from your bank account every single month. What does it cost under Part B? There's a deductible this year of $283 per year, and that's paid to the provider. So you have to pay the first $283 out of any Part B claims, and then it's going to kick into that 80-20. So you're going to pay 20% out of pocket for all covered medical expenses under Part B. Now, if you delay Part B, you could be penalized. So there's two different ways that Medicare can penalize you. If you don't take out Part B right away, and if you don't take out Part D right away. So let's say you continue to work and you don't want to go on a Medicare. That's just fine. You won't have to pay any penalties down the road. But if you're 65 years old and you don't have any other sort of credible coverage, then you go add that Part B later on down the road. The longer you wait, the more that penalty keeps building. But once you get it, it stops that bleeding. So it increases by 10% for every 12 months that you go without signing up for Part B. So let's say you go 24 months, that's 2 years. That's going to be 20% additional on top of that $202.90. So 20% of $202 is going to be somewhere around $40 additional per month that you have to pay every single month for the rest of your life. And that penalty also will potentially increase if that Part B premium increases from year to year. Medicare does not pay all healthcare costs. So there's a couple of different ways that you can cover what Medicare doesn't pay. The problem with that 20% that Medicare doesn't pay is there's no ceiling, there's no cap. So you're unlimitedly exposed to medical bills. That's the biggest hole in Medicare. Almost every other insurance out there that I've ever seen has what's called a maximum out-of-pocket. Most employer-provided group plans, usually $5,000 or $10,000 max out-of-pocket. So you're not bankrupt if something happens. The average cancer treatment costs $100,000. And if you have to pay 20% of that out of pocket on Part B, you can do the math, it's about $20,000. So it's so important that everybody on Medicare chooses either Route 1 or Route 2. So we're going to start with Route 1. That's going to be a Medicare supplement plan. So this is going to do, just like it says, supplement your Medicare. So this is going to pick up that 20% that Medicare doesn't pay. The coverage levels are going to vary by plan. There's 10 different plan letters that you can choose from all the way from A to N. They're standardized by CMS. The insurance companies can't just do whatever they want. They all have to provide identical coverage, identical benefits. The only difference between the plans and the companies is the price. So they can all charge different premiums, but they all have to give you the same exact coverage. So most of the time when I'm helping people shop for a Medicare supplement plan, we're looking at who's got kind of the most competitive premiums, because if you're not, usually you're overpaying for your insurance. Medicare supplement plan letters. So you can see Plan F here is the one that covers 100% for every single box here. Plan F is no longer offered if your Medicare started after January 1st of 2020. So if that's you, you cannot buy a Plan F. The next closest when it comes to the amount of coverage is the Plan G. So it covers everything that Medicare does not cover except for that Part B deductible. So once you meet the $283 deductible out of pocket, if you have a Plan G, then you get 100% coverage for everything for the rest of that year. So if you have a $5 million hospital bill, that supplement's going to cover 100% of that bill. So these plans are offered by insurance companies. There's about 30 or 40 different insurance companies that offer these supplement plans. So the Plan G is the most popular plan purchased right now, and the Plan N is going to be next to it. So there's only a couple of differences between the Plan N and Plan G, but the Plan N is becoming a lot more popular over these last couple of years as these premiums have continued to increase. So you can see the only differences are with the Plan N, you also have $20 doctor visit copays after that deductible has been met and $50 emergency room copays. The other difference is it does not cover Part B excess charges. So if a doctor does not take Medicare assignment, which there's about less than 1% of doctors out there that don't, so it's extremely rare that you'll ever run into this. But if they have a contract with Medicare that allows them to charge more than the Medicare allowable amount, then you could be potentially charged an extra 15% for that visit. A Plan N is usually going to be somewhere around $40 to $50 less per month than a Plan G. So if you're not going to the doctor 2-3 times a month, most people come out on top with the Plan N, but some people just don't want to mess with those additional copays and headaches. So the premiums are going to depend on the area that you're in, but in most areas, Medicare supplement premiums are going to range anywhere from about $140 a month to $200 a month. And it's important to shop these plans every single year as these premiums change, because there's always going to be competitive options out there to choose from. So kind of like your car insurance, you want your insurance person to constantly be shopping your plan to make sure you're getting the best deal. What's nice about these Medigap plans is you can go to any doctor, any hospital, any facility nationwide. If they accept Medicare, they have to accept the Medicare supplement plan. The providers don't get to decide which insurance companies they take and which ones they don't, because it's a Medicare supplement plan and they're all standardized. You do have to health qualify for these unless you're signing up for the first time or have some sort of guarantee issue right. So if you're turning 65, you can buy any one of these plans that you want. And that time period lasts 6 months. There's also other guarantee issue windows. Some states have specific anniversary rules where you can switch from one company to another company with no underwriting within a certain time period per year. A lot of people get this confused with the annual enrollment period. October 15th through December 7th is when you can shop and switch Medicare Advantage plans and Part D plans, but that has nothing to do with your Medicare supplement plan. If you want to switch that, you have to be healthy enough to switch to a different company. How to select the right plan? We're going to ask you some basic questions like your age, your gender, your date of birth, if you live with somebody or not. There's different factors that go into these premiums, and we're just going to give you unbiased plan data and help you compare against all your options. So the first two parts of that first route is original Medicare and a Medicare supplement plan. So the last part to this is Part D, because Medicare does not cover prescriptions. It covers Part B prescriptions, but it's not going to cover your basic prescriptions that you go get at the pharmacy. So you have to have Part A or Part B to qualify for a prescription plan. D is the one that makes sense, D for drugs. You can enroll between October 15th through December 7th each year. And these plans change drastically every year. The premiums will go way up, way down. The formularies will change. Some prescriptions will go on or drop off the formulary. So it's important to review these every single year because there's lots of options out there. Some people can also qualify for assistance programs based off of their income. The most common one is called Extra Help with Prescription Drugs, and this is offered through the Social Security Administration. So it's not an insurance plan you're signing up for, it's just an assistance program that could drastically lower the cost of your prescriptions if you qualified based on your income. You could also be penalized if you don't take out Part D when you're first eligible. So some people that are 65 years old are active and healthy and don't take any prescriptions. And I hear a lot that I don't need a prescription drug plan. Well, if you don't take one right away, you don't have to, but if you add one later, you'll be penalized every single month for the rest of your life. So the penalty is going to be 1% times the national average of a standard prescription drug plan times the number of months that you went without coverage. So if you only went without coverage for 1 year, that penalty isn't going to be too bad, usually $2 to $5 per month. But if you go without it for 10, 15 years and then add it because you get a diagnosis later on down the road, it can be very, very expensive for the rest of your life. Again, how to select the right plan. We're going to ask you your prescriptions. We're going to ask you which pharmacy that you go to, the dosages, the quantities on your prescriptions. There's no one Part B plan that's best for everybody. They're all individualized based off of your particular prescription drug list. So this wraps up the first route of Medicare. So you're going to start with your Part A and Part B. You're going to pay $202.90 a month. And then you're going to buy a Medicare supplement plan G or plan N for an extra $140 to $200 a month. And that's going to give you about 100% coverage except for that $283 deductible. And then the Part D plans, they do have additional premiums for most plans. Usually those range anywhere from about $5 a month to about $30. I've seen some plans in the 80s or 100, but most plans are somewhere around 5 or 30. And you will have additional copays you'll have to pay for your prescriptions for the most part. Some generic prescriptions you can get at no cost, but usually each prescription you'll have a copay that you'll have to pay at the pharmacy. So the last part is Part C. So that's what we're going to talk about next. Part C is a more combined plan. It actually takes over and replaces your original Medicare. So your Part A and Part B, you still have it, but it goes away and it no longer pays any more of your claims. So Part C is like Pac-Man. It's going to gobble up that Part A and Part B, and that insurance company that you go with is fully going to administer your Medicare. So they're offered by private insurance companies, but they can't just do whatever they want. They're still standardized and regulated by CMS. They have to follow the CMS guidelines and cover everything that Part A and Part B cover. They can't leave anything out. So there's going to be networks on these plans. There's HMO plans and PPO plans. Those are the most two common Medicare Advantage plans. In some areas, there's also what's called private fee-for-service plans. So HMO plans means that you have to stay within your plan's network. If you go out of network, most of the time you don't have coverage. If you have a PPO plan, usually you get out-of-network benefits, so you can still see a doctor even if they're not in your plan network, if they're willing to bill. So most people prefer PPO plans because it gives them that flexibility, but a lot of times you have to sacrifice your coverage and benefits because for the most part, HMO plans are going to have lower out-of-pocket costs, lower copays, and more benefits available. So you've got doctor networks. They're copay-based plans. So it's not just a set it and forget it. It's more of a combined all-in-one plan. So you kind of pay as you go, like most traditional type of group employer plans. So you're going to have a copay for each service that you have. So for your doctor visits, usually you're going to pay anywhere between $0 or $10. For a specialist doctor, usually $30 or $40. If you have a surgery, usually about $300 or $400. If you stay overnight in the hospital, usually that's about $300 or $400 per night that you're in the hospital. So you're kind of nickel and dimed as you use your insurance, but some people that are healthier and keep their usage pretty low will come out on top because most of these plans actually don't have any additional premium. So they're funded by the government to take over. So the government's saving quite a bit of money on your claims because they're not paying them anymore. So they're going to incentivize these Medicare Advantage plans to come and take over because those Medicare Advantage plans are going to have a lot more oversight on your care. And they're going to make sure things are medically necessary. And they're going to eliminate a lot of the fraud, waste, and abuse with Medicare. So they're designed to help keep costs down for everybody. And one way that's a benefit for you is there's no premium attached to most of these plans. Now, some of them do have premiums. Usually you'll get benefits beyond original Medicare. A lot of these plans will come with benefits like dental coverage, vision coverage, hearing. Some of them will give you money to spend on over-the-counter benefits. Almost all of them give you a free gym membership. Some of them will even give you money to spend on groceries at the grocery store. So lots of benefits out there on the table for people that are on Medicare Advantage. Plans also change yearly. So they'll change all those copays and benefits every single year. So it's important to shop every year as these plans change. Original Medicare or Medicare Advantage. So again, that's the two options. Route 1, Route 2. That Route 1, you're going to have your 202, your $140 to $200 a month for your Medicare supplement, and let's say $10 to $20 a month for that Part B plan. The Medicare Advantage is going to take over for Part A and Part B, but you still have to pay that Part B premium. So that one's just going to cost you $202.90 a month because there's no additional premiums attached to it. But now you have copays, so you pay as you go. So you could end up paying more on Medicare Advantage if you have a bad year. Now, the statistics say that on average, people save $1,400 per year on Medicare Advantage. But what I found is the dollars is not what speaks to everybody. Everybody's different. Everybody has a different appetite for risk. Everybody has different needs, different usage, sees different doctors, has different travel needs. There's so many different scenarios. And I found that I'll meet two different people that have the same exact life, same health, same routine, same everything. And I'll give them the same presentation and they'll choose two different options because that's what you have to decide for yourself is what is your appetite for risk? These Medicare Advantage plans can be great, but they can be very costly. What's nice is they all give you that maximum out of pocket. So even if you go with one, you're not going to be bankrupt if you have to use your insurance. Usually they'll cap that your medical expenses in 1 year to about $3,000 or $4,000 or $5,000. So at least you get that ceiling where you would not have gotten on traditional Medicare Part A and Part B. Long-term care. It's the biggest hole in Medicare I see. 70% of people at some point in their life will need that type of care. Medicare does not cover long-term care to help you recover, but it's not going to cover long-term care. So it's so important if you have any assets to protect any nest egg. We hate to see people work their whole life and build up their retirement and their savings and their legacy, and that just go away due to nursing home costs. So it's so important to prepare and plan for this. There's 3 ways to pay for long-term care. That's going to be private assets, just money that you have. That's going to be insurance, and that's going to be Medicaid. Most people don't want Medicaid paying for the long-term care because you have to go to certain facilities and your assets get stripped. They take away your Social Security check sometimes. And when it comes to money that you have, most people can't pay $8,000, $9,000, $10,000 a month to cover their long-term care. So it's so important that you plan for this as well. Retirement planning. We also help you make sure that you're not going to outlive your money. So it's important to talk to an estate planning attorney and a financial advisor, someone that's going to advise you on your Social Security and how to not outlive your money. Medicare Made Easy. So this is our company here, Senior Benefit Services. Certainly don't have to use us, but it's so important that you use somebody that you can trust that's going to be unbiased with you, that's going to give you those annual reviews and help you shop the market every single year. There's so many fly-by-night salespeople out there. You want someone that's going to not just sign you up for the first time, but be there every step of the way with you and answer questions along the road, because the decisions you make today are going to change down the road, and you need someone to give you that guidance. So we also help people with different types of insurance, like life insurance, cancer insurance, vision, dental, hospital indemnity, long-term care, and more. So again, this is me here. You can scan this QR code. Again, it doesn't have to be us, but it's so important if you're aging into Medicare that you get someone that's going to be unbiased and not try to persuade you towards one company or one plan and help you make that decision. All right, so if you made it this far, you're already ahead of most people. Hope you learned something today. Medicare definitely does not have to be overwhelming. It can be a lot more simple than people make it out to be. So get educated on those options in your area, because this is just a general educational video. There's thousands of plans out there that you could potentially enroll into. So don't hesitate to reach out. I'm happy to help. Hope you learned something and hope you have a great day.